Welcome back for the second portion of Joy in Our Town. Thank you for joining us once again. I'm your host, AC Dunlap, and our guest for this segment is Kathy Angel, Adult Protective Services Case Manager, and Kelly Johnson with the Community Care Registry and Caregiver Support Programs for the Franklin County Office on Aging. They join us today to discuss elder abuse in Central Ohio, along with the factors that may prevent an elder adult from reporting the abuse. Welcome, ladies.
Thank you.
Thank you.
How are you?
Pretty good. How are you doing?
Good. Thank you for joining us today. Can you talk to us a little bit about who you are individually and then about the Ohio Department of Aging?
Okay. I'm Kathy Angel, and I'm a licensed social worker, and I work with Franklin County Office on Aging with the Adult Protective Services Program. I've been working in the Adult Protective Services Program for 24 years.
Wow.
So I have a passion of working with older adults. I have a bachelor's degree in business administration, but I decided that I like helping people. So I went back to the Ohio State University to get my master's in social work. I'm specializing in gerontology.
Okay. And you?
Yes. I'm Kelly Johnson, and I'm working with a couple programs within the Office on Aging. One is the Community Care Registry, where we actually link private pay home care workers with the private pay community. And these home care workers, they can go out and provide any type of non-medical home care assistance to people in need in the community. And then we also have a caregiver support program where we're able to help out caregivers of older adults in the community with different type of respite services and caregiving support for them while they're actually working. Well, I won't say working, but in the capacity as caregivers.
Okay.
Yeah.
So you talked about your departments. Can you tell me maybe specifically what are your personal responsibilities within the department?
My specific responsibilities is actually going out into the community, making home visits on older adults who are 60 years of age and over, and basically to investigate alleged allegations of abuse of older adults, whether it's physical, self-neglect, neglect, financial exploitation, or sexual abuse or abandonment.
Similar to what I mentioned earlier, managing the community care registry program and also being a coordinator of the caregiver support program, linking the caregivers up with the services that they're in need of.
Okay.
Yeah.
So what exactly is elder abuse?
Elder abuse is basically when someone, whether it's intentional or unintentional, try to harm an older adult, whether it's to inflict physical or mental anguish on that older adult. And usually it's by somebody that they trust, whether it is a family member, such as a spouse, a nephew, or niece, or grandchild, or their children. So, and usually what that person does is basically prey on that older adult's vulnerability and take advantage of them. And then from the term elder abuse, and then that's when it's actually broke down to whether to the physical or the neglect. Or the financial abuse, or the sexual abuse, or the abandonment.
What would you say are the social or psychological impacts, I guess, or impact on victims of elder abuse?
When an older adult is abused, usually it affects them because a lot of times, especially if an older adult has been social, they may start to become more withdrawn.
Okay.
Or let's say, like just how me and you, how we are talking right now, and then maybe the person who has been abused and them come walking into the room, then maybe they start looking scared, not wanting to make, that eye contact, with you, because they're scared of what that person is going to do to them. They may suffer from depression, and just not want to be bothered with anybody.
So if you think that someone may be a victim of elder abuse, what do you do as someone from the outside?
One thing I want to say is that elder abuse is what we call a silent epidemic.
Okay.
Because it's basically something that is really not reported. It is a social issue, and it's not really reported in our society. It's estimated that over 6 million cases each year when an older adult is actually being abused. So that's basically a case every 5 seconds. And out of one case when an older adult, where abuse is reported on an older adult, then there are 4 cases, at least 4 cases that go unreported. So if you see that someone an older adult is being abused, and you don't, let's say you don't know that Adult Protective Services exists, because a lot of people don't even know that there is an agency that will go out to investigate elder abuse. So I would suggest to call the police, at least call somebody. Just don't sit there and see an older adult being abused and don't get the help necessary. Because one thing about it, we do have mandated reporters, and the police officers, they are one of the mandated reporters, just as if it's a doctor. A lot of people don't realize that clergy, they're mandated reporters, but they are. Nurses, other professionals in the social services arena, podiatrists, your dentists, paramedics, they're all mandated reporters. So at least call someone. We get calls all the time where someone calls and they say, well, should we report this this person because we feel like they've been abused. We do have an intake line. And what the intake worker will do is just listen to the person on the other end. And they can, be the judge as to whether or not this is something, that should be taken for the supervisor, to assign a Adult Protective Services case manager, to go out to investigate. Don't see something happening to an older adult and you don't do anything about it.
Why do you feel people are so ambivalent to report something such as this?
I think it may be contributed to the stigma, kind of similar to child abuse, when at one point it was like, what goes on in the home stays in the home, and then with older adults, because of the dynamics with a majority of the cases, that come into our office, and that we see the alleged perpetrator is someone that they trust and that they know.
Right.
So if I tell on my grandson, he's going to get in trouble and then further impact what's going to happen to me. Will I have to go into a nursing facility? Will, I be removed from my home? So a lot of times, it can be contributed to that.
So if I'm a person who is being abused, what would you say to me as an older person, if I'm being abused, let's say financially? Someone came into my home and everything was okay, and then suddenly now I have no money, I can't pay my own bills. What would you say to me?
Yeah. We get a lot of calls on that too, when an older adult, they may trust, let's say, their son or daughter, to handle their particular finances. And what we do is that we will talk to them and we will ask them if this is, show them that, okay, hey, your son or daughter has made this much withdrawals out of your account, or they forged your name on credit cards or bills, or they brought a car in your name. What is it that you want to do? Because one thing, and with the Adult Protective Services, we have to be careful, is that the older adult, they have the right to make decisions as well. They have the right to be part of that case management, that care planning, because they are adults. And a lot of times people think that because they're adults, they're elderly, that they shouldn't be able to make their own decision, but they're not children. So we have to ask them, what is it that you want to do? And a lot of times the older adult may want to report it, sometimes they may not, because just as is what Kelli had stated, is that sometimes they're afraid. What's going to happen to me if I say that my child is taking my money or has forged my name on bank account statements?
And one of the biggest pieces when we go out to do the investigation is determining someone's competency. If her competency is intact and she's not having any issues in regards to that, and she tells you, I don't want to do anything, I know this is happening, this is my son, this is how it's always been, we can't, do anything on her behalf, or go outside of what she's requesting. So a lot of times, like if we go out and they're like, even with the service piece, because I know we talked about the abuse and exploitation, but even with self-neglect and neglect, if we go out and we see that a person is just simply in need of some home care services. And you're like, this will, greatly impact your life, improve your quality of life. If in turn they're refusing to access that and they're competent, there's not anything that we can do in regards to going outside of that to bring services, into the home.
Do you make a notation, or do you do some type of documentation to where even though the person refused service, that is kind of notated that if something comes up down the line, there's like a history that was documented?
Yes, we do. We do keep a documentation on that. To show, because sometimes we do have histories where the case keep coming back. And it's okay if it keeps coming back. But one thing I always tell people is that, especially, let's say it's a son or daughter and they're taking care of their older adult. And sometimes, a lot of times, people get very angry when we come out because our home visits is more intrusive because we ask questions that people don't like for us to ask. And a lot of times they also look at us as being the older adult police.
Yeah, the nursing home police.
Yes, that we're gonna come out and we're gonna take them out their home, which is, which is not the case. But one thing I always tell people, if you're doing what you're supposed to do, and that's provide the proper care for your mom or your dad, then you really don't have anything to worry about. And so then what we do is that we'll just document it, and ask them, is there any services that you may need, to help you care, for your older, your older parents. Because a lot of people may not be aware that there's even services available.
What other type of services are available for people that may be victims or maybe know of someone?
We work with, we offer a program called Senior Options, where we're able to provide a lot of home-based services, transportation, Meals on Wheels, I Fall and I Can't Get Up button, that caregiver program, the community care registry, a home repair program, a wealth of services that are guided just to keep older adults in the home. So when, we do go out and people are thinking, nursing home police, that's like furthest from, the image that we want to portray, because the whole premise of the agency is being able to have these services being placed, in a home where someone can just stay in their home and maintain their independence.
And that's one good thing about Adult Protective Services being housed in Franklin County Office on Aging, is because even though we go out and we make home visits, but if an older adult needs senior option services, such as Meals on Wheels, a homemaker, a home health aide coming into the home, or even the caregiver support program, maybe the caregiver is stressed out, overwhelmed, and they need, that relief, then what we can do as advocates is come back and try to make a referral to the Senior Options program or the caregiver support program or the home repair, et cetera, to get those services in the home. Because one thing we try to do is, if it's possible, is to keep that older adult in their home as long as they can.
And be able to keep them informed. So like, if we do go out this month and they're not ready, they're refusing the services, they'll have the information, maybe 2 months later, they'll call, and access services.
We definitely thank you, ladies, for your time. Thank you for sharing this information. It is very vital for our community, and we thank you. That's our program for today. Thank you so much for watching. You can also check us out on Facebook at WSFJ TV 51. Join us again next week at the same time for Joy in Our Town.
This program has been sponsored by the Trinity Broadcasting Network and is made possible by your telethon dollars. Your continual support can keep Joy in Our Town coming to your home every week. Write to Joy in Our Town, 7790 North Central Drive, Lewis Center, Ohio, 43035.